Hello and welcome back to GP Video Podcast by Nadia. So, for a long time, I have been wanting to make a few or many video podcasts on something very, very, very important called Autism Spectrum Disorder or ASD. But because my knowledge is or was or still is quite limited on it, as to be very honest, in Pakistan, because I've done my MBBS from Pakistan, and when we studied pediatrics back in 2004, it did not have autism spectrum disorder in the curriculum. I might be wrong. So if anybody from my batch, especially my batch, is listening to this podcast can correct me if we did have autism spectrum disorder in our curriculum, and but I do not remember it. Yes, I do remember attention deficit hyperactivity disorder, which is ADHD, but do not remember ASD, studying about ASD. Got to know about it when came to Australia. Then prepared for exams like Australian Medical Council exam, so had to read about it. Still not too much of information. Then I worked in hospitals for 10 years. There also, we get all the emergency cases, and even in the pediatric ward, I worked for at least 6 months to 1 year actually, gynecology ward and all of that, but never encountered ASD patients. I mean, even if I encountered ASD patients, they were with acute issues. They had come in with appendicitis or gastroenteritis or respiratory infections or any other issues that needed hospitalization. And you know that hospitalization is for acute and life-threatening cases, not for behavioral disorders. Yes, for behavioral disorders, if they are like very, very bad and at their peak. But yes, so again, my knowledge remained deficient in it, just to put it out there. But when I joined general practice in March 2023, of course, there are so many other conditions that my knowledge was deficient about, but at least I knew about them. I had theoretically studied them. I had read about them. I knew their management a bit. I knew what they are all about. But I think autism spectrum disorder or ASD was one of those topics that, again, my knowledge was very, very less. In fact, one time when a parent said that my child suffers from ASD, and I actually said, oh, atrial septal defect. And he said, no, autism spectrum disorder. So you can see that that ignorant I was. No, I mean, I knew the name, but I didn't know that it is also abbreviated as ASD, which is atrial septal defect as well, which is also found in kids. So, yes, but I've been trying to gather courage to be able to address this issue, because it is a very, very, very common issue. Yes, there is no medical treatment, no medicine to fix it, as there is one in ADHD, as there is one in anxiety, as there is one in depression, as there is one in PTSD, as there is one in other mental health conditions, most of the mental health conditions, but there is no medicine to cover the symptoms or to be able to symptomatically manage the condition. But still, it's very, very common, and GPs should have as much knowledge as they can so that they can spread the knowledge, and also offer the service. There is no medicine to eat and get the symptoms fixed, but definitely there are so many support services and so many allied health arenas that we can propose to the parents and be able and help them and get them out of as much out of those behavioral disorders that or neurodevelopmental disorder characteristics that we can. Okay, so I would try and explain it and see how we go, but as you know, I'm passionate about this. So I might make some mistakes, but that's why whenever I do a podcast, I try and make sure that apart from my own wordings and my own explanation, I actually have something in front of me which is from an authentic source. So usually what I consult with is number one is, I've always told you, it's John Murtha General Practice book, which is actually the Bible of general practice. The other one is called Up to Date. Up to Date is a very, very, very nice medical website, which is actually American, but I've got the subscription and I really, really like reading about it. Yes, the guidelines are different from Australia in some cases. For example, there are differences, of course, in the numbers, prevalence, and epidemiology. There is difference in management in different cases, like what we have as the first line, they don't have, or they have as second line, we have as third line, or stuff like that, but usually it's similar. Then for Australian authentic websites, we have got therapeutic guidelines and Australian medicine handbook. These help me a lot with the medications and with the therapeutic guidelines. What else do I refer? Then there is another website called Community Pathways, which is different in different states, but it is also a very, very good resource for referring to by the GPs. And then I've got another subscription called Medscape. That is also a very good website. I've got a few of the subscriptions that I just opened them. They are at least 8 to 10 in number, and whenever I'm in the clinic as well, I try and open them all in front of me. So whenever I'm in dilemma, even if I'm not in dilemma and I'm sure about the medical management of a condition, but I still refer back to them to see if I'm making a mistake or not. And when I'm doing podcasts also, I usually try and get some material beforehand so that I should be able to read that and then try and explain it if needed. So so let's just try and explain. So there has been a lot, when I studied this, when I was trying to read the actual definition, I got to know that there has been a lot of changes in the definition of autism spectrum disorder. So, and this has resulted in a change in the way autism is diagnosed. So for example, ASDs are very, very common, with the latest Australian data putting the incidence at 1 in 100 children. While autism diagnoses are much more common in recent decades compared to previously, because it was only described as a disorder in 1944, because the definitions have been changing, so it's very we can't really compare the data we have today with the previous times, because the definition has changed, and it's at some arenas it has become more wider, and at some arenas it has become a bit narrower. So we'll try and see what it is. So autism spectrum disorder is a biologically based neurodevelopmental disorder characterized by persistent deficits in social communication and interaction. So one domain is social communication and interaction, and restricted repetitive patterns of behavior, interests, or activities. So these are the two domains that we look at a kid in. Number one is social communication and interaction. So social communication and interaction, and restricted repetitive patterns of behavior, interests, or activities. So these are the basic two domains. Symptoms become apparent when social demands exceed limited capacities. Severity is determined by functional impairment and can be critical in the ability to access services. So, what are the two domains that we have? We have social communication deficits and repetitive behavior. So social communication and interaction deficits and repetitive behavior. The pathogenesis of ASD is incompletely understood. The general consensus is that ASD is caused by genetic factors that alter brain development, resulting in the neurobehavioral phenotype. 10 minutes approaching. I'll talk to you in the next podcast.